Good afternoon, everyone. So, the International Agency for Research on Cancer is the research organization of the World Health Organization entirely dedicated to cancer research. Our mission is to understand what causes cancer and how we can prevent cancer. We are also responsible for putting together the statistics on cancer incidence, mortality, prevalence, survival all over the world. Currently, we work with 185 countries in all continents to achieve this aim. In our research areas, we focus on the most prevalent cancer types and the most common cancer types in India and elsewhere. Particularly in India, we have been doing studies on oral cancer. As you know, oral cancer, oral cavity cancer, is very common in India. And the reason for that is that there is a large use of tobacco in many forms, smoked but also chewed, as well as other products such as betel quid, which is chewed, and this increases dramatically the risk of oral cancer. We have been doing studies to understand if screening, observing lesions in the mouth would decrease mortality for these cancers. And our results indicate that this is indeed the case. We have also been conducting studies on HPV, human papillomavirus, vaccinations in girls to understand if 1 dose of vaccines, 2 doses or 3 doses would be effective in preventing HPV infection and consequently HPV cancers. And our results indicating that the vaccine is safe, and actually 1 dose is as good as 2 doses or 3 doses when used in adolescent girls or early adolescent girls between ages of 9 and 13, which is the best immunological window for response to the vaccination. But pretty much until age 16, at least 1 dose of the vaccine is highly efficacious against getting infected with human papillomavirus, which is the cause of cervical cancer and other types of cancer as well. So understanding the burden of cancer, how many patients there are, how many people are affected, is very important for planning the services, but also to comparing yourselves against other regions in India and elsewhere to see, can you do better something? Do your patients have the same incidence than other countries, the same survival as in other regions and other countries? For this purpose, cancer registries are absolutely essential. So what are cancer registries? Cancer registries are databases where you write down the name of the patients, the age of the patient, and which is the type of diagnosis the patient has and when was that diagnosis established. You also notify the age and the sex of the patient, and you try to follow this patient along the time to see are they cured or are they progressing with the disease, or unfortunately are they deceased, are they dying from the disease. In this sense, I really salute Apollo's initiative to create hospital-based cancer registries. That means the registries which are inside each hospital, because with that information, in addition to clinical information, you can evaluate yourselves against other healthcare structures. So these are usually what we call hospital-based cancer registries. Another type of cancer registries are what we call population-based cancer registries. That means that you study an area of a region of a country or a country. In India, since it's such a big place, usually it's by region or by cities, and you study not only the patients that come to your hospitals, but all the population that can go to different healthcare facilities, different hospitals, etc. And you pull all that data in a comprehensive database that gives you the answer. What's the incidence and the mortality for cancer in a specific geographic area? So the hospital-based cancer registry answer questions about how the population attending a specific hospital is doing and what's their influx of patients and how the treatment is being given. And the population-based cancer registry answers a different type of question. is what's the burden of cancer in a specific geographic area. Both are extremely important. Usually most places in the world start with a hospital-based cancer registry and then they expand to a population-based registry. So all the information you collect is necessary and is important. It's better to start at least with a hospital-based registry and as soon as possible expand to a population-based cancer registry in determined areas of the country. Thank you for citing this example. Indeed, the Institute Gustave Roussy is an institute in Paris, in France, that is very advancing in providing quality service for women. And quality service not only in terms of diagnosing treatment, but how women are taken care comprehensively. And what is so innovative that when the women come to do a screening, basically in one day the woman have all the services, and if the woman has a diagnosis, she exits the hospital on the same day already with a treatment plan done. So that's very good because it decreases anxiety and women feel that they are in control of the situation all at once, and they can be followed up throughout their cancer journey, because it's a journey, it's a disease that requires different types of treatments for an extended period of time. Coming back to India. India has many cancer challenges. I think the first challenge in India is the volume of cancer patients. Each year in India, we see over 1.4 million people getting cancer. This is massive. And actually the healthcare system has difficulty in coping with the volume of patients. So I think the volume of patients is the main challenge that India faces now. Also, the types of cancer that the Indian population developed are quite different than in other parts of the world. One example is cancers of the oral cavity, exactly because many people chew tobacco and other products that make developing cancer in the oral cavity. Particularly for this type of cancer, just examining the mouth, being it in the hospitals or even in primary healthcare centers or by a dentist or by a nurse which is trained to detect any lesions, what we call leukoplakias, is extremely important because these lesions, they can be seen just by a naked eye, just examining the mouth and the throat of the patient. And only this very simple type of exam would detect lesions early and would lead to an early diagnosis and early treatment. So I think you need to adapt and not only think big technology, expensive technology, but things that are adapted to the challenges that India observes today. Another type of cancer which is common in India and causes a lot of issues is colorectal cancer. Colorectal cancer is bowel cancer. Is a very common type of cancer, but when detected early, you can be treated and patients can survive a very good life even many years after diagnosis. To detect this cancer early, there are very simple tests which are to detect blood in the feces. And this can be done with tests which are quite cheap actually. You have very, very simple tests, but this needs to be done regularly, let's say every year or every second year. But also if the patient observes any changes in the stool pattern or in weight loss, it's super important that they search healthcare providers as soon as possible. Similarly, among women in India, there is a very high burden of breast cancer in young women and in middle-aged women and in elderly women. And here it's a big challenge, again because of the volume of patients. But what we know, based on information from cancer registries, is that the survival of breast cancer in India is lower than in other places of the world. Why is that? The main reason is that women seek care quite late in their cancer journey. That means they find a modification in their breast, being it in the skin or in the nipple or a volume in the breast, a mass in the breast, but they don't seek care for different reasons. So it's very important that women are aware of how their normal breasts is, and they might differ of course between different women, but if there are any modifications, that the women seek medical care as soon as possible, to get informed, is there an abnormality that could be a cancer? Because if the cancer is detected early, the prognosis and the survival is much better, is easier to treat, and the treatment is highly efficacious. Thank you very much.